Thank you. Hello, everybody. It's an honor to be here. It's incredible to see the blending of backgrounds. And I'm excited to share with you a journey, I would say, that's taken the majority of my medical career to bring me here to bring together a holistic and evidence-based side of stuff. So the idea for surgery ceremony came to me while I was in the operating room. I noticed how many patients that were under conscious or local sedation would often have a profound emotional release. Sometimes these moments would feel ceremonial in nature, and it led me to ask, what if we intentionally treated surgery as a sacred transformation journey? So I'm going to go over some of the origins of my experience, the protocol that I've developed that I use with my patients on a regular basis, and we'll get into some of the details of the protocol as well as some anecdotal experiences. A bit about me: I completed a plastic surgery residency in Montreal, Canada, alongside my colleague here, Roman Brazil. I did a fellowship in aesthetic surgery here at USC, and I'm in private practice here in Beverly Hills. I also work as an advisor for Neuralink on surgical protocols and procedures. My day-to-day practice is aesthetic and reconstructive surgery of the face and body, and I focus mostly on wake procedures. So I believe that surgery is not just a medical procedure, but a truly transformative experience. The word ceremony takes its origins from the Latin word ceremonium, which is a sacred rite. Historically, surgery has always had these ritualistic elements. If you look back at documents as far as 1600 BC, describe surgery as a ritual, a rite, process. It's interesting that there's corollaries, there's similarities between surgery and ceremony. It's a strong desire for transformation, an elevated or altered state of consciousness, be it through meditation, through medicines, through different drugs. And ultimately, the patient, the guide, the participant has to undergo a journey, whether it's in the operating room or outside of that. Even in modern surgery, surgery ritual exists. The process of informing consent, setting an intention, preoperative fasting, gowning and draping, ceremonial garb, preparation of the surgical space, the surgical count, sterility. These are all echoes of ancient ceremony, even if we don't label them that way. And surgery has evolved. Protocol has replaced process. Efficiency has replaced ritual. But at its best, surgery is still a type of a ceremony, a structured, sacred event for transformation. I like to think of an analogy of flying as a ceremony. The process of flying is an incredible experience, whether you're in a plane, skydiving, whatever it might be. But leading up to that experience, there's a protocol, so the rules and regulations set by the FAA, the process of learning how to fly, which is flight school, and the ritual, the pre-flight checklist. Surgery is no different than this. Taking a step away from the ceremony side of things, I just want to touch base on the psychology of surgery in general, specifically as it relates to my discipline, plastic surgery. A plastic surgeon by the name of Maxwell Maltz wrote a book called Psycho-Cybernetic, and he observed that changing a face or appearance of somebody could really dramatically change their behavior and self-image. And we know today that as many as 16% of patients undergoing surgery will have some sort of psychiatric diagnosis. All that to say is everybody's holding a lot when they go into surgery, even if they're not talking about it. It's my belief that in surgery, there's a transformation of the body, but it's also a transformation of the mind and spirit. We have to be able to support patients emotionally, energetically, not just physically. So the solution that I have developed and proposed is this protocol called surgery ceremony, a process to guide patients through the surgical process. It's a 3-part protocol, starting with ketamine-assisted psychotherapy, followed by surgery, which I'll get into the protocol in more detail, and the third part is body work with lymphatic massage. As some of you may know, that ketamine is a powerful tool traditionally used in anesthesia. It promotes neuroplasticity, it opens a dissociative, expanded state of consciousness, and it's perfect for setting deep, lasting intentions before surgery. It's well studied for treatment-resistant depression and suicidal ideation, and its effects can be rapid and lasting. making it an ideal preparation tool for patients that are about to go under major transformation. So in the ketamine-assisted protocol, or ketamine-assisted psychotherapy, I'll call it CAP from now on, patients undergo 3 sessions with the therapist. The first is just an intro session. So they speak to the therapist again, very clear. I call it like surgical therapy. So basically, the therapist is helping them clear on their intentions, why they're undergoing surgery, any fear, anxiety, or trauma they have related to the procedure. Then they undergo a actual ketamine-assisted psychotherapy session with a ketamine lozenge, anywhere from 100 to 200 milligrams. And the focus of the session is to help lower the ego defenses and allow patients to really drop into their experience and bring up anything that they might otherwise not be able to. And then they have an integration session with the therapist. The goal of this session is for me to work with therapists and extract information that I can then use live during surgery. So we use a specific music playlist every time, and during the ketamine-assisted psychotherapy session, the patient will give certain keywords, hints, and intentions of why they're going to surgery, which then the therapist will share with me as notes that I can use during surgery. So as I mentioned, the goal for the therapy session is to set an intention for the surgery, to be very intentional about what's going on, to understand the reasons why the patient is undergoing surgery, and address any fear or anxiety they have related to the procedure. It's about connecting to the parts that are usually difficult, because surgery is so focused on the body, and this is a chance to honor the experience of the mind. Ultimately, this process is creating resources for the patient. So things like mantras, symbols, archetypes, things that they can bring up in the surgical experience that I can use in addition to anesthesia, to help them feel comfortable. So now we get to my part, the surgery. Thanks to Human, actually. We'll get to this later. Dr. Francine is a pioneer in ketamine research, but he shared this protocol with me from back, and it's become the foundation of my protocol of what I use in the operating room. So the nitty-gritty detail of the protocol is basically 0.5 milligram per kilogram IV infusion of ketamine. It starts with a low bolus, and then in addition to ketamine, I also use a numbing solution for the type of surgery I do. And if the patient has not had previous ketamine exposure, or I have any concerns about their ability to handle the procedure, I'll use a benzodiazepine. In addition to medication, there's psychosomatic support, which I find to be an extremely important part of the process. So I use the same playlist that they had during the therapy session, and it creates a sort of neuroacoustic recall that gives patients a sense of comfort from their previous journey. I use vibrating touch points, which are used in EMDR therapy as a way to help ground the patient to their somatic experience. Eye mask, I have a vibrating pad on the OR bed. And then I'm recalling the resources that the patient brought up with the therapist. So any keywords, intentions, and really bringing in as much evidence as I can from their previous experience to help them feel calm and comfortable. So research shows that even under general anesthesia, the brain can still physiologically respond to surgical trauma. So awake surgery offers this gentler, more conscious alternative, one where the mind stays engaged and not disconnected. Up to 2% of patients under general anesthesia experience recall. This can create an extremely traumatic experience after surgery where waking nightmares can cause PTSD. And keeping consciousness engaged can be a very helpful way to avoid this trauma altogether. Interestingly enough, it's not just enough to be sedated during the procedure to help after surgery that might help with symptoms of depression or maybe anxiety. It's actually being a conscious participant experience. You might ask, why do surgery on patients who are awake? And it's allowing the patient to be a conscious participant in the experience. I already mentioned that music is a huge part of this, so I reuse the same music, the same playlist that the patient's already familiar with that creates a sense of familiarity and comfort with the entire process. And there's significant evidence that using this kind of music recall, if anyone here has a favorite song you like to listen to, imagine hearing them in the operating room. It creates a sense of comfort and peace. And finally, the third part of the surgery ceremony protocol is grounding back in the body. So it started in the mind, elevated into this transformation of the body, and now we come back to the body through body work. So this, I'm very grateful to work with a talented team of manual lymphatic massage drainage therapists, as well as body workers, acupuncture. And there's copious amounts of evidence that having an experience after surgery to ground you back into your body is a way to kind of make sense of the reality of everything that's been disturbed. In addition to the psychological benefits of having body work, there's significant improvement in circulation and blood flow, which is very helpful for wound healing. And in my protocol, I had patients meet with the therapist 2 to 3 times a week for about 4 weeks. And again, I use the same kind of playlist that they've been familiar with the therapist and in surgery, and it helps ground the entire experience. So a bit about the outcomes. This is all anecdotal from my experience so far, but I've been doing this protocol for the past 1.5 years. I've treated over 34 patients. And consistently, what I'm noticing is that patients report decreased postoperative pain. I no longer use narcotics in post-op. It's just over-the-counter pain medication. Patients report saying that they have a faster return to their daily activities. But most importantly is improved mood right after surgery. There's a known thing in the plastic surgery community, which is plastic surgery blues, just so that every patient undergoes this sort of depressive state after surgery. And consistently, I have patients report things to me like, this process helped me break through my past trauma that's been inhibiting my growth potential. My body feels like my home again. I feel like I can finally accept and love my body. My doubts and worries for the procedure are gone. This one was one of my favorites. I honestly feel an excitement, a different type of excitement for not only the procedure, but the integration of all the tools that I gained and learned from experience, and for the transformation that's yet to come. So consistently before and after surgery, patients are reporting this is an experience that helps them feel much more comfortable with surgery, but also overall an enlightening experience. So I envision, my hope is that surgery ceremony expands beyond the scope of plastic surgery, which is why I'm so honored to be here and share this with everyone here, into other surgical disciplines. But my belief is that anywhere there is surgery, there can be ceremony, and I hope transformation.